Jerusalem Syndrome. Jerusalem Syndrome is an uncommon psychiatric disorder in which visitors to Jerusalem have severe religious delusions or psychotic episodes. This condition is frequently prompted by the city's religious significance, which leads to beliefs about becoming a biblical person or having a supernatural purpose. Those suffering from the syndrome may require mental care or hospitalization to ensure their safety and well-being. Social Anxiety Disorder. Social anxiety disorder, often known as social phobia, is an acute fear of social settings and interactions caused by a fear of being judged, embarrassed, or humiliated. Symptoms may cause people to avoid social events or public speaking, resulting in substantial anguish and impairment in daily life. Therapy, medicine, or both are commonly used in treatment to assist manage symptoms and enhance social functioning. Obsessive-compulsive disorder, OCD. OCD is a mental health disorder marked by overbearing, unwanted thoughts, obsessions, and recurrent behaviors or mental acts, compulsions. Common obsessions include dread of contamination or intrusive thoughts of danger, whereas compulsions frequently entail rituals such as hand-washing or checking. Cognitive behavioral therapy, CBT, medication, or a combination of the two are often used treatments. Attention Deficit Hyperactivity Disorder, ADHD. ADHD is a neurological disorder marked by recurring episodes of inattention and hyperactivity. Symptoms include trouble paying attention, organizing tasks, and impulsiveness. Behavioral therapy, medication, and support techniques are common components of treatment. Agoraphobia. Agoraphobia is an anxiety condition characterized by a strong fear of circumstances or locations from where escape would be difficult or embarrassing. Individuals suffering from agoraphobia may avoid busy locations or being alone outside the home. To help people confront and control their concerns, treatment usually consists of therapy, medication, or a combination of the two. Paris syndrome. Paris syndrome is a temporary psychological ailment that affects travelers visiting Paris, characterized by emotions of dissatisfaction, anxiety, or mistaken views about the city. Symptoms may include hallucinations, paranoia, or derealization, which are caused by the disconnect between tourists' expectations and the reality of their encounters. Those affected may seek reassurance, assistance, or medical attention to manage symptoms and maintain their well-being. Narcissistic Personality Disorder. Narcissistic Personality Disorder is an illness in the mind defined by a chronic pattern of grandiosity, an insatiable desire for admiration, and a lack of empathy for others. Individuals with NPD frequently exhibit an inflated feeling of self-importance, exaggerated accomplishments, and entitlement. Therapy may be used to address underlying issues and create healthy coping methods. Alien Hand Syndrome. Alien hand syndrome is an uncommon neurological condition in which one hand behaves involuntarily as if it has its own volition. Individuals may notice their hands doing acts or movements without conscious control, often contrary to their wishes. Management techniques are required to assist individuals in coping with symptoms while maintaining functionality. Piblokto. Arctic Hysteria. Piblokto, commonly known as Arctic Hysteria, is a culture-bound condition affecting indigenous Inuit people in the Arctic. Episodes include illogical behavior prompted by acute cold and isolation, such as yelling, uncontrollable laughter, or disrobing in freezing temperatures. The specific reason is unknown. However, it is thought to be linked to cultural beliefs, social stresses, and environmental factors. Schizophrenia. Schizophrenia is a serious mental condition that affects a person's ideas, emotions, and behaviors. Signs include hallucinations, hearing voices or seeing things that do not exist, delusions, false beliefs, disorganized thought and speech, and decreased emotional expression. Antipsychotic medicines, therapy, and other services are often used in combination with treatment. Wendigo Psychosis. Wendigo Psychosis is a cultural phenomenon reported in some Native American tribes in which people believe they will convert into a cannibalistic creature known as a Wendigo. Symptoms may include a strong desire for human flesh, hallucinations, or aggressive behavior, which is frequently motivated by fear, starvation, or social isolation. While rare, these incidents emphasize the interaction of traditional beliefs, mental health, and environmental stressors among indigenous populations. Hypersexual Disorder. Hypersexual disorder, often known as compulsive sexual behavior, is characterized by intense and recurring sexual fantasies, desires, or behaviors that disrupt normal functioning or create discomfort. To address underlying issues and recover control over sexual behaviors, treatment options may include therapy, medication, or support groups. Bipolar disorder. Bipolar condition is a mood condition that alternates between mania and depression or hypomania. Depressive episodes include prolonged melancholy, changes in appetite or sleep, and feelings of worthlessness, whereas manic episodes are characterized by heightened mood, increased energy, and impulsive behavior. Mood stabilizers, therapy, and other support services are frequently required throughout treatment. Jumping Frenchmen of Maine disorder. It is an uncommon startle disorder characterized by extreme and uncontrollable reactions to unexpected stimuli or demands. Individuals with this syndrome may exhibit severe startle responses, such as jumping, shouting, or imitating others' actions beyond conscious control. The specific reason is unknown, but it is thought to involve genetic, environmental, and cultural elements. Wonderland Syndrome or Alice in Wonderland Syndrome. This rare neurological disorder, sometimes known as Alice in Wonderland Syndrome, produces perceptual distortions, particularly in size and space. Individuals may have experiences such as things or body parts seeming larger or smaller than they are, thinking as if their body is shifting size, or experiencing their surroundings as distorted or unreal. Treatment focuses on controlling underlying medical conditions and alleviating associated symptoms.